What have you seen in areas outside of the beginning of the first wave hotspots? You know, we had seen issues in areas like Washington State, New Orleans, New York, New Jersey, et cetera. Where are the cases spiking now, and how's that translating into calls?
The biggest increases we've seen in the last month have come from Florida, Texas, and Arizona, more than tripling in those states. We still see broad engagement across a number of conditions beyond just COVID-19. So at the peak, COVID-19 was around 20% of our overall cases. It's since subsided down to single digits, and in the last month, it's crept back up into closer to 20% of our overall cases that we see.
Now, are you able to, on a macro scale, track things like, are the ages of people calling in about COVID-19 getting younger? Are doctors recommending you need to go in and be hospitalized more or less often than they were earlier in this pandemic?
We are seeing a little more normalization of the age curve, but we've also brought on 35 million Medicare Part B recipients to our platform. So that's lifted the average age up because now seniors on Medicare Part B can use our service for a very small copay. And so it moves the data in a little bit different direction, but we are seeing a higher incidence of younger patients in the last couple of months.
Now, Hill, Julia here, tell me a little bit about how you're integrating with these lab tests, because, you know, you could do a doctor consult over the phone, but then there's this question of sort of how do you actually get the results? How are you seeing sort of the deployment of those tests, and how are your patients dealing with figuring out whether or not they need to get an actual test?
So we built a number of tools on our site. We were the first telemedicine company to launch a free health assessment back in February 28th, and we've iterated on that probably 30 times. So people can come get a free assessment and just get advice to see if they need to take a test or if they need to just stay at home and check their symptoms and come back. If they see one of our doctors and our doctors believes that they need to take a test, we hand them over to our care team, and our care team works with this patient to identify their geographies, what their health insurance benefits design plan looks like, and can direct them to either a local testing facility or a mail order testing service.
Speaking of testing, it sort of raises the question about, I mean, we keep hearing anecdotally the lag in terms of turning a test around, getting results from a Quest or a LabCorp. It's impacted some of the practices that professional sports teams have been trying to hold. Do you see that tightening up anytime soon? And what do you think is causing it?
Well, I think we continue to underestimate the number of tests that we really need to be effective at managing this pandemic. And just as we've been steadily ramping up production of testing, so has the viral spread. And so we're just seemingly playing catch up across all dimensions of this. And so the testing lags are concerning. It's just sort of two steps forward, one step back. And we just need more. We need more capacity.
Dr. Ferguson, there's a lot of controversy out there right now about the difference between testing and cases versus hospitalizations versus deaths. Personally, my sense is that hospitalizations are perhaps the most important number to track because we don't know the demographics of the people being tested, how high risk they are, other factors that can make the data muddy. What do you think is the most important number to track from a public health perspective, and how closely should we be watching the relationship between, say, hospitalizations and deaths?
Well, let me be clear. I'm not a doctor, so nor am I a public health expert. So,
sorry, I shouldn't have called you Dr. Ferguson, then Hill.
Yeah. As much as I would like to take that credit, I simply cannot. No, I think the hospitalizations number is an important one. So are the overall case counts. I think it's a mix of all of them that we need to track. And most importantly, we need to make sure that we're communicating consistent messaging to all of our people in this country and wearing masks and practicing social distancing. The death rates and the hospitalizations are going to fluctuate based on geographies and testing rates and a bunch of local demographics. But I would defer to the public health experts as to what the single best metric would be.